Good morning, everyone, and welcome to the Gulfport Reports with an update from the Chiefs. This is our first program of 2021, and we're so glad that you've joined us. My name is Tracy Yanez, and I'm the director of the Gulfport Chamber of Commerce. We're a division of the Mississippi Gulf Coast Chamber of Commerce. And if this is your first time attending one of our events, I want to welcome you. And if you're not already a member of the Chamber of Commerce, we're glad you are here. And we hope that you consider checking us out more and joining our chamber. You can find more information on the benefits that can be found on our website at mscoastchamber.com. I'd like to thank our wonderful sponsors today, Memorial Hospital and Hancock Whitney. It's because of their generous support that this virtual event today is being offered as a complimentary event to the community. And so we are so grateful for that support.
To the people stepping up in the face of an unprecedented challenge, we say thank you. Thank you for everything you're doing to serve our communities and keep us safe. To the people of Hancock Whitney, thanks for being the ones our clients can count on. The comforting face in the window, the trusted advisor, getting it done for the people we serve. Because even though it feels like everything has changed right now, it's reassuring to see that some things haven't.
I'm Heather.
I'm RJ.
I'm Sinead.
I'm Stephen with Hancock Whitney.
I'm Zanae with Hancock Whitney, and I'm here to help.
We'll get through this the same way we always do, together.
Our mission at the Chamber is to connect, inform, advocate, and develop. And I hope you join us for our, not only today, but join us in upcoming events, including our Gulfport Connections. This event will be, is one of our quarterly events, and a program, this program will feature Carol Harris. She is the Director of Small Business and Minority Division for Mississippi Development Authority. And that program will be also virtual on February 18th. And we'll also have that complimentary, again, thanks to our sponsors. You can find registration for that event in our chat box, as well as we'll be popping in a number of other Coast Chamber events that are coming up. I hope you check those out. You can register for those through the link in the chat box, or find more information on our website and on our Facebook page. So just a little housekeeping. If you're not familiar with Zoom, if you kind of just hover your mouse over the screen, you'll see a bar that pops up, and there is a Q&A feature at the bottom. You can submit your questions here. We will be taking the answering questions at the end of the program, but feel free to pop your question in that feature anytime during the program. To make sure you get the full experience, we do recommend that you have it in your view and speaker view. That way you just have kind of blocks out all the other things going on. And be sure to check in on our Facebook event. Just show your friends that you are engaged and having a productive morning. So I want to thank my boss, Adele Lyons, for joining us. Adele, do you have some words you'd like to share?
Hey, y'all. Good morning.
Just thank you to the Chiefs for joining us. Y'all are, of course, a group of great guys that, safety is so important. And we've seen that lately here in our country. And it's so important for y'all to talk about what's going on in our communities and the efforts y'all are taking to continue safety in those communities. So thank you so much for being with us. And like Tracy, hope to see you all in person soon.
Thanks, Adele. Now, all right, the Gulfport Reports program is designed to better connect with leaders of Gulfport. Each program features a selection of city directors, business and/or community leaders who provide updates on their respective areas. So I want to thank everyone again for joining us, but a special thanks to our Gulfport Chief of Police, Chris Ryle, Gulfport Fire Chief Mike Beyerstedt, and AMR's Chief of Operations, James Carver. Our first responders obviously provide valuable services that help keep us and our community safe and healthy, as Adele said. And the success of their efforts also provides important economic factors because in the end, it attracts businesses. It is a factor that attracts businesses and families to locate to the coast. So we're going to get started and with the update, and we're going to start out with AMR's James Carver. Welcome.
Thank you, Tracy. Good morning, everybody. I hope everybody's staying safe today. And thank goodness 2020 has passed us and looking forward to what 2021 has in store. I'd like to take this opportunity to congratulate Ms. Beverly Martin and Mr. Kent Jones for their new appointment for the Board of Supervisors. Really looking forward to working with you this year. I'd like to get started with this. AMR has served the Mississippi Gulf Coast for more than 45 years. In those 45 years, we have handled many disasters, such as catastrophic hurricanes and mass casualty incidents. 2020, however, brought something completely different, the coronavirus pandemic. EMS has truly been on the front lines of this pandemic. AMR has stepped up to handle this global medical emergency that has affected the Gulf Coast and the communities we serve. Being the lead EMS agency in the county, our duties often expand beyond the ambulances on the street. We supported the county by having a paramedic at the EOC 5 days a week, acting as the emergency support medical officer since the beginning of this pandemic. This position is still active at the EOC as of today. AMR also works very closely and supports all the fire departments in the county. At the beginning of the pandemic, we were supplying updates and kept open communication with all the fire departments. The main goal was to make sure everyone was kept up to date about the virus and to keep everyone safe and healthy. Back in February, when this all began, no one was sure exactly what the extent of the virus would manifest to. Once it started to spread across the country, there were constant changes and updates. We had to make rapid changes to our responses, from our call-taking standpoint to our response, and even the care we provide to our patients. As the virus evolved, and the more that we learned about the virus, it brought constant changes to our daily routines and to the communities. Being on the front lines of the pandemic, we have taken many precautions to ensure our crew's safety. We take safety very seriously. We have created a single point of entry into our facility and have implemented that, as our checkpoint to screen every employee entering our building for the COVID-related symptoms. This is mandatory at the beginning of each shift prior to entering. Employees' temperatures are taken and monitored daily. PPE requirements, our crews are to wear the appropriate PPE on every call. We assume that every patient has COVID or has been exposed to COVID. We increase our level of PPE when responding to and transporting a COVID positive patient. We always do a thorough decontamination of our ambulances after any transport, and we've taken that step further and fog our ambulances that transport COVID positive patients. Across the country, the COVID-19 pandemic response has impacted all aspects of the medical system. Emergency medical services were not excluded from these impacts. Now that the lockdowns have eased for our state, we are seeing the increase in our calls for COVID, plus our normal call volume as well. We are starting to see a sicker population. People are waiting longer to call us for transport. I'd like to take this opportunity to encourage you not to do that. Regardless of the pandemic, you should always seek medical care when it is immediately necessary. It is very important to call 911 for life-threatening emergencies. For any other health issues, please visit your physician or urgent care. Hospitals are overwhelmed with patients, so going to an appropriate level of care when you don't need hospital level services is very important during this pandemic. The local physicians' clinics and urgent cares have the capabilities to accept and treat patients. Do not hesitate to seek medical care from a healthcare professional. So what challenges has COVID pandemic brought to EMS? Bed capacities at the hospitals is a day-to-day challenge. EMS works very closely with the hospitals daily to manage the volume of patients coming in or going out. Our decontamination of units. After transporting a known positive COVID patient, the ambulances are brought back to the office for full decontamination. We use a fogger with a disinfectant that's placed in the patient compartment of the ambulance and runs for 15 minutes. Once that is complete, the fogger is turned off, the ambulance sits with the doors closed for another 10 or 15 minutes. Then after that, the crews must completely wipe down the ambulance, both front and back. This takes the crew out of service for at least an hour. The stresses and anxiety placed on crew members while working in a pandemic and worrying about bringing the virus home and spreading it to their family or friends is something we face daily. The COVID-19 response has been a very stressful time for anyone who is in the healthcare field. We've all had friends, coworkers, or family that have become sick, and some have passed away due to the COVID-19 virus. So what does the future hold for EMS? There are a lot of people who are leaving EMS in the healthcare industry because of this pandemic. This has added extra stress to those who remain because they are left with the extra load. Now that the vaccines are available, we are hoping to see some relief. We are optimistic that with more vaccinations being administered, we will start to see a drop in the number of positive cases daily. Recently, AMR worked with Memorial Hospital and was able to hold a vaccination site at our operations center. The vaccine was made available to all AMR employees and all Harrison County Fire Department personnel. This project was very successful and they administered many vaccinations that day. As you know, there are currently 2 vaccines available, the Moderna vaccine and the Pfizer vaccine. While they are similar, they are different. They are both the 2-dose series, Moderna separated by 28 days, while the Pfizer is separated by 21 days. The vaccines are not interchangeable. So if you take your first dose as the Moderna, your second dose must be the Moderna, and so on with the Pfizer. Both vaccines are highly effective at a rate of 95%. That means 5% of those vaccinated will not develop antibodies or immunity. Also, the receipt of the vaccine does not mean instant immunity. It takes time to build up that protection, which is further bolstered by the second dose. So theoretically, if one is exposed to COVID virus while the immune system is developing, or if the individual is one of those 5% of no responders, the infection post-vaccination is possible. AMR will continue to move forward and support the communities we serve as well as all the first responders. Over the past few years, we have replaced a majority of our fleet. We now have 23 of the new transit type ambulances. We're scheduled to receive 8 more this year. We are actively recruiting EMTs and paramedics. On February 1st, we will start our very first ever Earn to Learn program. This program is designed to give people the opportunity who want to get into the healthcare field. It's going to be an EMT class for people with no experience. The class will be 3 days a week, 8 hours a day, and they are paid to attend the class. When they complete the class and pass National Registry, they will be employed full-time for at least 1 year with AMR Gulfport. This program has generated a lot of interest, and we had over 40 applicants. Over the past few years, AMR Gulfport has participated in the National Mission Lifeline program through American Heart Association. The Mission Lifeline measures certain cardiac compass measures. One of those measures is recognizing a true cardiac emergency. AMR Gulfport is above the national average on recognition and 100% on getting those patients to the appropriate facility with the cath lab capabilities. In 2020, AMR was awarded the gold status from AHA's Mission Lifeline. I would like to conclude this with a quote from Oliver Goldsmith, an 18th century poet. Life is a journey that must be traveled, no matter how bad the roads and accommodations. Remember, the journey of 1,000 miles begins with a single step. It's imperative to take that first step. Thank you.
Thank you, James. I mean, just to hear what all that you have to go through in a daily process through this, I mean, obviously, in even just a regular circumstance, there's a lot that weighs on your team, but the added steps, and appreciate that and appreciate what y'all are doing to keep everyone safe. So we're going to move on next. Again, if you have questions, feel free to use the Q&A down below. We'll get to those at the end. But next up, we're going to hear from Gulfport Fire Chief Mike Beyerstedt.
Good morning, Tracy. I'm happy to be here to speak to all of you today, even though we're doing it via Zoom. Like you said, I'd rather be in person where I get to visit with everybody. But I'm just happy to be able to have the chance to talk about the great things going on at the Gulfport Fire Department right now and the wonderful people I work with every day that help deliver emergency services here in the city of Gulfport for us. I put together, I got a few slides I'm going to switch over and pop, I should say attempt to pop up here for you to look at while I kind of go through my presentation, so you just don't have to zone in on my made for radio face here. So I'll try to get that going here now. Share screen. Okay. Share. Can you see my presentation, Sherry? I mean, can you see my presentation, Tracy?
Yes, you're good.
Okay, thank you. The Gulfport Fire Department, you know, like I said, we do a lot of different things, and I wanted to start off by asking people, why do people call the Gulfport Fire Department? And for many of you, you probably say, well, that's easy. You call when your house is on fire. And we certainly hope that you do that and you call 911 if that happens, but we're called for a wide variety of emergencies on a daily basis. We're a true all hazard department here in Gulfport, and people call the Gulfport Fire Department when they're overwhelmed with their circumstances and typically having one of the worst days that they're ever going to have in their lives, and they just don't know what to do or who to call. And so, you know, that requires us to be trained and ready to respond to a wide variety of different types of incidents. Maybe it does involve, you know, a house, car, boat, or wildland fire, but more often than not, we're responding to some other kind of emergency. Starting out with the fire side of things, we're pleased to provide our citizens with a fire protection classification of a 2, which that puts us in the top 2% of fire departments all across the country. I'm very proud of that, and it was a lot of hard work, and we were the only one we were the first one in the state, and we're the only one in the state for 2 years. I am happy to say that Biloxi recently just received a 2 rating as well, so they're doing a very good job providing safety services for their city as well. Our department, we're covering the 67 square miles of Gulfport out of 11 strategically placed fire stations throughout our city. And this year we completed a project that has been more than 25 years in the making. And that was the construction of a new fire station 9. 25 years ago, plans were put into place to build a new station in that area, but it took until this year for us to align things and get that project done. It's a beautiful station, and we're really proud of it, especially in light of the fact that we were able to complete the construction on time, on budget, and even though it took place all through the middle of this COVID crisis that has impacted us all so greatly. Some of you might be thinking that 11 fire stations sounds like a lot for a city of Gulfport, but for 67 square miles that we cover, we're actually spread very thin, about as thin as we can be. The station locations are determined by our ability to get our citizens in a reasonable amount of time. It takes, 6 minutes is the goal that we shoot for and is a standard. From the time you call 911, we should have a fire truck pulling up at the front of your house. And this is important for several different reasons. A fire doubles in size every 30 seconds. So if it takes us much longer than that to get to your fire, the chance of us being able to save lives, property, and your pets is drastically reduced. On the emergency medical side of things, which James, went into quite well, the brain begins to die without oxygen in the 4 to 6 minute range. And so our emergency medical technicians and paramedics need to get to you within that same time frame so that our medical outcomes are as good as they can be. Because of our response times and highly trained people, we have a CPR resuscitation rate that far exceeds the national average here in the city of Gulfport. And our medics and our EMTs are very proud of that, and so are we. And it's an added value that we provide for the citizens here in Gulfport. James kind of touched on that 2020 was a crazy year in the emergency services business. Certainly anything unlike I've ever seen in my 30 years in the industry. the year of, just thinking back on it, you think back at the beginning of the year, we were just kind of worrying about a new flu type of virus that was happening in China, just kind of hearing about it, wondering, is it going to get here? Is it not? But here's a spot where I'd like to call out the professionalism and foresight of my team here. And back in December, Deputy Chief Kelly had the foresight to begin procuring protective equipment for our people back in December when you could still get stuff. And then, as things tightened up and it was clear that it was hitting our shores, that PPE became scarce and you couldn't get it anywhere. And because of his foresight, we were well equipped with it. And we even loaned PPE to our hospitals here in town because we've done such a good job of being prepared in advance on that. And as the COVID crisis unfolded, myself and my staff put together a daily email for our city council and our mayor that covered the spread, precautions, guidelines, and news of PPE availability. And my other deputy chief, Thomas McCorkle, did a great job tracking the data and preparing graphs that allowed us to track where we at as a city, a state, and a nation, and helped us as a city to make effective policy decisions as we progress throughout this COVID crisis. Gulfport firefighters have handed out more than 50,000 masks at community events, along with hundreds of gallons of hand sanitizer. And we have assisted in planning the COVID precautions for our other city departments and have kept most of them supplied with things like sanitizer and masks throughout this pandemic. We've even gone in and decontaminated departments where positive cases had appeared and we could not get outside contractors in time to keep that city department operational. As James mentioned, that they were fogging their equipment, their ambulances to ensure that the safety of their people and to prevent the spread. We were doing the same thing with our fire trucks and also our fire stations all throughout the pandemic to try to keep that spread down. But COVID was not the only thing that made 2020 a crazy year for us here at the Gulfport Fire Department. In an average year in Mississippi, we have about 2 federally declared disasters. And in 2020, our state had 11 declared disasters here in this past year, in addition to the pandemic. And that was more than we've ever had. Like I said, it was a new record, and it was even more than the previous 5 years of natural disasters put together. So Gulfport firefighters were at the front and center responding to many of these emergencies. And then we were called on to travel both inside the state and outside the state to assist our neighbors in response to their emergencies. Here's a picture of one of our crews unloading a boat there en route to one of those emergencies. Hurricane Zeta was certainly the worst of those for us here in Gulfport, and there was not a minute of that storm when we did not have units out on the road responding to the emergency calls of our citizens. We were also cutting down the trees and clearing the roadways so that we could get our patients to the hospital throughout the night. In the recovery phase, we handed out thousands of tarps and pallets of bottled water to our citizens who were struggling to find the resources they needed to recover from Zeta. How do we have people who are capable of responding to the wide array of responses we see? It comes back to training. Gulfport firefighters logged more than 25,000 training hours last year in a wide variety of disciplines, ensuring that when Gulfport citizens call 911, we'll have people and equipment and training needed so that we can handle whatever emergency they're calling about. We train in areas such as fire science, emergency medical services, fire suppression, tech rescue, high angle rescue, swift water rescue, overland search and rescue, hazardous materials, confined space, dive rescue, laws and codes, drone operations, and also we do a lot of physical fitness training here as well so that our people are ready to handle whatever the conditions deliver to them. Our training department is charged with keeping our people certified and trained to deliver that wide variety of services I just mentioned. And Eric Baez is doing a great job leading us in that area. And we've developed training partnerships with the State Fire Academy, Mississippi Gulf Coast Community College, AMR, the Southern Mississippi Planning and Development District. And through these processes, we train firefighters not just for Gulfport, but all along the coast. Firefighters and fire departments send their people to Gulfport to get the best training that's out there. Most recently, we put on an advanced emergency medical technician class, and it was the first one offered by a fire department in the state. And that's allowed us to increase the number of advanced life support engines we have on the road. And that ties back into that high CPR save ratio that we see that's beating the national averages. That EMS side is another area where we've been innovators as we've worked with our Gulfport Police Department to develop the first SWAT paramedic program in the state. Gulfport firefighters now are on calls with the police department and are full-fledged members of the SWAT team. And we get calls from all across the country asking people to, what we're doing, and they're modeling their programs after what we're doing here in Gulfport. I would be remiss if I didn't mention our inspection and prevention departments as well, as they're in charge of inspecting the high hazard occupancies we have in the city, managing engine company inspections, and we also do the low hazard occupancies through our engine companies. And those people are also dual trained so that they conduct fire investigations as well. And we have a team of 3 human inspector investigators, and we also have an accelerant detection canine toggle who's been a great addition to the department and been very helpful in some arson convictions, as well as also does a great job when we're doing public education with the kids in the schools. During the pandemic, these folks had to shift gears a bit and were called on to spend quite a bit of their time ensuring businesses and we're following the occupancy guidelines and safety policies that we had in place here in Gulfport. And that led to us having, a safer transition as we've gone through this pandemic. I'm getting ready to close here, and I spent a lot of time talking to you all about the programs and procedures that we have in place that allow us to deliver the services we do. But the real secret sauce of what makes the Gulfport Fire Department what it is and such a special place is the tremendously dedicated people that we have. They got into this line of work because they wanted to help people by serving their community, and they find ways to be difference makers every day here at the fire department, whether that's taking on additional responsibilities, managing programs, making repairs at fire stations, or just making a difference in a citizen's life. They never cease to amaze me and make me proud of the great work we're accomplishing at your Gulfport Fire Department. Thank you.
Thank you, Chief Beyerstedt. As definitely, again, I'm just always amazed at being able to hear just how encompassing y'all's roles are. We just don't, I think we take for granted sometimes just how much y'all do and contribute. So now we're going to go to Gulfport Police Chief Chris Ryle. Chris.
Good morning. Thank you, Tracy, and thank you to the chamber for hosting this today and allowing me to have a few moments to talk about the Gulfport Police Department. I'm going to also share a screen with a PowerPoint. Mine's not quite as pretty as Mike's. I don't have all the pretty pictures, but he sets the bar high. So. And Tracy, let me know when we can see it. See it? Can you see the screen?
Yes, sorry, I was on mute.
Okay, great. Just some data from the Gulfport Police Department, and to show you just how busy we are. We are the busiest police department on the Gulf Coast by far. And last year, the Gulfport Police Department answered 97,539 calls for service. That goes from anywhere from, the basic stranded motorists to traffic stops to burglaries to violent crimes. And so you can see we're quite busy. with that, we had total incidents of 20,462, which resulted in 27,205 police reports. Throughout the year, we made 6,685 arrests and issued 18,511 citations and 544 DUI arrests. You know, it shows down at the bottom that our total sworn officers allowed is 169, but all this work is being done by about 155 police officers. And so that's including detectives, our school resource officers, our patrol officers, in our traffic unit. So we have about 14 vacancies we average. And so you can see our guys work quite a bit. The crime statistics from last year, you can see we were up in a lot of areas. Our homicides were up 33%. We had 4 more than the previous year. Rapes and robberies were down 34%, which is good. But the concerning number here is our aggravated assaults were up 31%. And what this is alluding to in this day and age is when young kids have disagreements, instead of when we were growing up, we'd have fist fights. They like to go by and shoot at houses. And that's our big issue is these kids going by and shooting up houses. And so we're working on a strategy, which we'll talk about in a little bit about how to address that. But the biggest jump was in arsons. And, you know, we can attribute that to what Chief Beyerstedt was saying with their K9 toggles. He's able to detect more arsons. And so, you know, in the past, you'd go to a fire and you would use the human eye and the human senses, but now you have that K9, which allows a little bit more sensory evidence, and they were able to identify more arson. So that's why I believe our arsons are up quite a bit, and we've made substantial arrests in those areas. The challenges of last year, obviously, James and Mike have both spoke about it, which is COVID-19, and it changed the way we policed a lot. You know, normally when we'd go to a call, we'd, you know, go into a house or make contact with somebody inside the residence. With COVID, we had to change that. We just didn't want to go into a house where we didn't know if that person was positive for COVID-19 or not. So we had to change the way we policed. We had to make sure we were maxed up and gloved up when we were making contacts with individuals. So it changed a lot. It also changed on when we arrested somebody, the jail for safety precautions limited to the number of people we could take to jail. And our number is 10 misdemeanors can be put in Harrison County Jail at any time. And so we're bound by those restrictions. So if we arrest somebody, unless it's a felony or a violent crime, we're more than likely going to release them from the station. And so that was a big challenge for us, and the workforce being sick. You know, we were pretty lucky in phase 1 of this COVID. We only had a few tested positive, but the second phase is hitting us pretty hard. We're out with about 8 out right now with COVID. And so we're having to deal with those manpower shortages as well. You know, in September, I was fortunate enough that the mayor and the council appointed me as the new chief of police. But when any new chief comes in, there's always some apprehension by the workforce, the troops, and to figure out, you know, what is his goal and what is he going to do. And so when I came in, I had 4 pillars I wanted to work on. The first one was our image. You know, we are lucky down here on the Gulf Coast. You know, we do not have the national narrative that is up north, and that's due to our relationships with our community. And, you know, and we'll continue to do that. Unfortunately, there are some groups and media outlets down here are trying to bring the national narrative to the Gulf Coast where it's not warranted. And so our goal is to work on our image. You know, we can always do things better. When people call the police, they call them not because they're having a good day, because they're having a bad day. No one's ever calling us, inviting us for coffee or tea or anything. So one thing we're working on is try to end all our contacts in a positive manner. You know, you can write somebody a ticket, unfortunately, but still be positive and be professional about it. So that's one of the main things we're focusing on. The second is workforce sustainability. As you heard me talk a minute ago, you know, even though we're allotted 169, we're averaging about 15 vacancies. And that's attributed to several things. And one of the things, there was a study out about a year and a half ago, 2 years ago, that law enforcement applications across the country are down 63%. And that's a huge number. This job, and due to the national narrative, is not what people want to do anymore. And if we are able to hire individuals or good police officers, they're only staying for a few years. This is not a career. And so we've got to make that change and make this police department and this profession a career-oriented profession again. And so that's our goal, is, you know, to close that vacancy gap, and once we get people here, to keep people here. As you can see with the numbers, we are busy, and so, you know, you can get burned out a little bit. My third pillar was a juvenile reform, mentorship, and outreach. As I was talking about those aggravated assaults, most of those suspects are juveniles, and right now there is no repercussions for these kids, no consequences. If I arrest a kid carrying a gun, a stolen gun, more often than not, we're going to take the gun and send them home. In the next week, we catch them again, it's the same thing. Unfortunately, we only have about 10 or 12 beds at juvenile detention, and the youth court judges and youth court itself is sort of limited on what they can do and, you know, availability. Mentorship, I think if we make these positive contacts with these kids and early outreach, you know, maybe we can change some of the dynamics of what's going on with these kids. So our goal is to do that. And then community engagement. We can't function without our community. And, you know, we try to do everything possible to get out into the community and be a part of our community, because that's where our relationships build, and that's why we do not have the national narrative. And so it goes back to image, but you know, we've got to continue, and we will continue to be out in the community. Unfortunately, COVID-19 has affected a lot of stuff we wanted to do. Every time we have planned something, COVID would come in and we'd have to cancel. So our goal is to continue our community engagement. You heard Chief Beyerstedt talk about hurricanes. You know, when we have a hurricane, it's expected to hit landfall. We require all of our employees to be inside the city limits 24 hours before landfall, and we had to do that a couple of times this year. Unfortunately, of all the 11 that Chief Beyerstedt talked about, only one really impacted us, but it impacted us more than we expected. But we still had to maintain our services. And so after Hurricane Zeta made landfall, we were able to get back on the road, do a damage assessment. Within a day, we had reached out to our state partners, and they were able to come down and help man the intersections. And also to keep our employees on the road, we assigned a group of our employees to go around and do assessments on our employees' houses. And during the hurricane, right after hurricane, the aftermath, we assessed and tarped over 40 of our employees' houses. So that gave them a peace of mind so they can focus on what they needed to do here at the police department. A promotional process, you see it as a challenge, and a lot of people say, well, how is that a challenge? Well, you can say it this way: the promotional times at the police department is probably the worst time for morale. And the reason I say that is only one or two people are going to be happy and several are going to be upset because they didn't get promoted. And so our promotional process is arduous. It takes about a month and a half to get through it. And you know, and our promotional list is good for a year and a half. And so you do the best you can, and you just keep moving forward. So far this year, since September when we did this, we have promoted 17 lieutenants, captains, and sergeants. And so, you know, and we'll continue to promote more, but waiting on that list to be promoted it can be a downer for many. Officer involved shootings. This is part of the business, unfortunately. Our officers have to use their service weapons. We were faced with something that's never happened on the Gulf Coast last year. Towards the end, we had 2 officer involved shootings that happened back to back. One happened on a Thursday, one happened on a Friday. And, fortunately, all of our officers went home to their families. They were able to use their training the way they needed to, and they actually saved somebody's life. And, even though, they did what they're supposed to do, it's still an emotional roller coaster for these individuals. We hope we never have to do it, but we always prepare for when we do. And then homelessness. COVID-19 really impacted our homeless population. A couple of years ago when Chief Papania was in office, we started the Homeless to Housing Club in Gulfport, where we partnered with many of our community partners, and our goal was to house the homeless. And unfortunately, with COVID, that the evictions, we were not allowed to evict. They were not allowed to evict, so we were short on housing for homeless. And so, we've had to come up with an alternative plan. And so we're still out for outreach, but we also understand that our businesses need relief. And so we've made a conscious effort to work with our businesses to get trespassing signs and the sign charges for trespassing if these homeless individuals decide they just don't want to leave these properties, or if they're out stopping traffic and causing traffic hazards, we will address those as well. So what's in store for your police department? We talked about juvenile reform and outreach. I really want to push legislation and get some legislation out there that holds these juveniles accountable, especially those with firearms. For any reason for a 17, 16, 15, 14-year-old kid to have a weapon, there's only one reason, and they're planning on using it. So if we have some consequences for these youth, maybe we can curb it that way. We're also going to do partnerships. We're going to do a youth police academy where we bring, some of these youths in and teach them about law enforcement. And we're also going to use that as a recruiting tool. We're also going to partner with boys and girls clubs, Cafe, or Climb CDC, I'm sorry. We're going to partner with those. And the earlier we can have these positive interactions with these kids, the better off we'll be. Community engagement. This is our bread and butter. This is what we have to do to be able to have these relationships. And some things we do here at the police department, we do a civilian gun safety class. It's a 2-day class where we'll teach you the basics of firearm safety and teach you how to shoot a little bit. It's a pistol course. It's not a rifle course. A lot of people want to bring their rifles, but it's not that. It's a pistol course. But we offer that about once a month. We have about 25 slots, and if you're interested in that, you can contact our community services department. Our civilian police academy. We hold this twice a year, and it's 2 hours every Thursday for 4 weeks, and we give you a run through of the police department. You get to hear what every division does. And our goal is, once you complete the police academy, is to be a steward for this agency, and you can understand what goes on here. And finally, community outreach. Any opportunity we have to get out into the community and interact, we're going to take it. Monday, we were out helping with the cleanup. We've done that several times. The Cafe Klein building in Gaston Point, we went and cleaned that after the storm. Community watches. Anytime we get an opportunity, we're going to use it to be out in the community. And then Project Eject. What Project Eject does is it's a federal program that addresses guns and gun violence. And so we are part of Project Eject. We kicked it off in September or October, and where those individuals who possess guns and meet federal criteria are prosecuted under federal law. And the federal statutes have more of a variety of what we can charge these individuals with than state statutes. And since the kickoff of this, we've made about 15 project eject arrests, got some violent offenders off the streets, and have gotten several guns. And so that's how we're going to address this gun violence, is just aggressive, proactive patrols to address it. And I think that's all I have. There's my information. Please write it down if you ever need to contact me. There's my office number, my personal cell phone, and my email. If you get a ticket, don't call my personal cell phone, because I'll just direct you to the court. But if you have issues or concerns, please don't hesitate to reach out. Thanks, Tracy.
You never answer when I call you, Chris.
Well, there's a reason for that.
Thank you, Chris, and thank you all. Real quick, before we transition, and again, if you have a Q&A, go ahead and be posting that in the Q&A section. But Chris, throughout your presentation, you talked various areas, talked about the youth and kids. Can you talk a little more about some of the partnerships that are taking proactive measures of keeping kids away? I know y'all do a lot of work with the schools and different programs.
Right. We have our school resource officer program, which our officers are in the schools within the city, and they're having that initial interaction. But since I've been appointed, I've talked to the Boys and Girls Clubs, and we want to do something. Just COVID is holding us back getting there, but our goal is to reach these kids at early on, and so maybe we can change their direction of what they're going to do. They're going to have a choice. I can give you case after case where these kids, they start off small, and they turn into our shooters. We're also working with the University of Southern Mississippi to develop a high risk abduction initiative where we can identify these medium risk youth, the ones that are starting to fight, hanging out with our shooters, like that, and start a program where we can grab them before they turn into the high risk, and maybe hopefully with partnerships with our community, get them some anger management, some counseling, and just positive interactions with law enforcement. So maybe we can turn them in the right direction before they go astray.
Yeah. And so speaking of anger management, stress management, I guess, how much do you contribute COVID to some of these increases that we saw this past year?
Oh, it's, we're facing something that was unknown to us. And when it's something unknown, it's stress. It's stressful. It's stressful for us here at the police department. I know it's stressful for the citizens. And, the main thing stressing us here is, our workforce. And like I said, we have 8 out with COVID right now. And you take 3 people test positive on a shift. Now you've greatly reduced our shift. And so we're having to hire people to hire out to fill those vacancies. And so the stress is there. And, the family, I know I have family members who are elderly, and, they're concerned. And when you're cooped up in a house all day and you can't leave, unfortunately, it's sort of like you're in jail. I mean, you have a little bit more freedoms, but you were locked inside your house. Or I know my stepfather who has some medical issues, but he's been locked in his house since March. And so it's going on a year, and, the stress of not being able to get out and do stuff I couldn't imagine having to do it myself.
Yeah.
I'd just like to kind of echo what Chris said there, that, for everybody in our community has been affected by this, and it has increased, the mental stress we're dealing with. We're seeing an increase in suicides over this. But it's also something that all of us at each agency, our first responders, are worried about their families and, coming in contact with positive cases. And that stress that Chris is talking about, you can either see that destroy people and organizations, or it can galvanize them. And, it's been a pleasure working with these gentlemen. They're true professionals as we've gone through this, but also in our city team as a whole. Everybody's really pitched in during this process, and it's new things for everybody, but it's really been something that made me proud to see how people have stepped up during, what could have been something that destroyed them. And certainly inside our departments as well, the AMR, the police, and the fire have all really stepped up to the challenge.
Thank you. So we did have one comment question, and I think I know the answer, and it probably applies to all of you, but it was in regard to the picture Chief Beyerstedt of a fireman changing a flat tire, and is that one of your services that you provide?
No, it typically is not, but that's like I was talking about, the secret sauce that makes this place special is a guy saw a need, a citizen out there struggling, and he, stepped in and helped them. He just got caught doing that. I'm sure there's people at at AMR and at the police department who do the same kind of thing every day. But that's just what I wanted to kind of point out, that our guys are trying to make a difference out there, and I should say guys and girls because we have both. They're difference makers out there, and however they can do that in our community, they do it.
Yes, I think you're right. All of your agencies and groups go above and beyond, and obviously find themselves in situations where they do see other types of needs that need to be met. And, it's great that you're there to provide that, again, above and beyond service. So, well, thank you all, gentlemen. Thank you so much. And thank everybody who joined us today. I want to also thank our sponsors again, Hancock Whitney and Memorial Hospital. Without you, we're not able to, provide this as a complimentary event. And so I want to wish everybody a wonderful day. Thank you, Chiefs. Go out and have a safe and healthy day.
Thank you, Tracy.
Bye-bye.
Bye-bye.